Sunnyside Academics, video number 3 on lipids, a refresher guide for professionals and students. Topic: disorders directly associated with lipids. In a broader sense, an off-balance of the body's circulatory lipids or lipoproteins can give rise to a disorder known as dyslipidemia. Drivers for dyslipidemia include lipid carriers such as chylomicrons, VLDL, IDL, LDL, and HDL. These lipid carriers, together with lipid catabolic enzymes, are known to be drivers for dyslipidemia. Dyslipidemia is a major cause of increased atherogenic risk and can either be in the form of hyperlipidemia or hypolipidemia, a form of dyslipidemia. Discussing hyperlipidemia. Hyperlipidemia refers to an abnormally elevated low-density lipoprotein LDL level and hypercholesterolemia. Elevated LDL can result from overproduction or reduced clearance of low-density lipoprotein LDL. It is a major cause of atherosclerosis and associated conditions such as coronary heart disease, ischemic cerebrovascular disease, and peripheral vascular disease. Overproduction of LDL can be associated with some sorts of gene mutation. Reduced clearance of LDL is known to be triggered by chylomicron remnants, which are mostly of dietary cholesterol. Dietary cholesterols from chylomicron remnants are deposited in the liver through a multi-step process mediated by ApoE. So, cholesterol deposits in the liver in turn reduce receptor-mediated catabolism of LDL to increase plasma LDL levels. Low-density lipoprotein LDL functions to transport cholesterol in blood circulation, delivering it to tissue cells where it is needed for cell repair, hormone production, etc. Elevated LDL level is abnormal because, despite LDL's function of transporting cholesterol to all around tissue cells, it also deposits cholesterol inside artery walls, which can be associated with atherosclerosis. This is why LDL is called a bad lipoprotein. Hypertriglyceridemia is a type of hyperlipidemia resulting from an inability to break down triglycerides found in chylomicrons and VLDL. Such inabilities can be a result of non-functional lipoprotein lipase for the catabolism of triglycerides. VLDL carries synthesized triglyceride from hepatocytes, while chylomicron carries dietary triglyceride from enterocytes, another form of dyslipidemia. Hypolipidemia is associated with low levels of high-density lipoprotein, or HDL. It occurs when there is underproduction of HDL or excessive clearance of HDL cholesterol, also known as HDLC. Its underlying causes could be gene variations, lifestyle factors such as diet and exercise, and certain medications. In type 2 diabetes, hypolipidemia results when HDL exchanges cholesterol esters with triglycerides in triglyceride-rich lipoproteins like chylomicrons and VLDL. Such exchanges reduce HDL levels in the system. Low HDL is abnormal because it functions to lower the risk of diseases by absorbing cholesterol from different parts of the body and returning it to the liver, where it can be broken down for excretion. This is why HDL is termed a good lipoprotein. Having given us a background of discussions, we can now more meaningfully understand why underproduction of HDL and overproduction of LDL can lead to diseases. Cholestyramine is a drug that is a bile acid-binding resin. It exerts its therapeutic function by binding to an opposite charge, forming a complex that is excretable in feces. By such effects, emulsification of lipids gets impeded, thereby inhibiting intestinal absorption of lipids. In the long run, this can reduce elevated LDL levels. Ezetimibe is another drug that inhibits cholesterol absorption through a different pharmacological mechanism than cholestyramine, but its purpose is also to reduce circulating LDL levels. Statins, such as atorvastatin, are useful for treating abnormal lipid levels and for preventing cardiovascular disease. They exert their therapeutic function by inhibiting cholesterol synthesis in body tissue cells, such as the liver and adipose tissues. Their overall purpose is likewise to reduce circulating cholesterol. Despite these drug-based therapeutic interventions, Lifestyle control has a greater potential for reducing vascular disease risks and at a much more affordable cost. Now let's discuss dyslipidemia of insulin resistance. This is another type of dyslipidemia, and it leads to hypertriglyceridemia and pancreatitis. Dyslipidemia of insulin resistance can occur in the absence of functional lipoprotein lipase, or LPL, or functional ApoC2, a polypoprotein. If lipoprotein lipase is not well functional, this prevents the hydrolysis of triglycerides found in chylomicrons and VLDL. Also, severe hypertriglyceridemia is said to have the tendency to impair blood flow to pancreatic tissue, causing ischemia and tissue destruction leading to acute pancreatitis. Dyslipidemia of insulin resistance can be controlled by nutritional intervention aimed at achieving low carbohydrate and fat intake. This will bring down insulin demand. This concludes our lessons on diseases and treatments in dyslipidemia, the disorder in circulatory lipid levels. Thank you for checking out Sunnyside Academics. Feel free to drop your comments or ask any questions.